Bismillahirrahmanirrahim. Assalamu alaikum. Inshallah, today I will explain the terms of position, the terms which are used for the limbs, and the terms of movement. So, this is the part number 2 of lecture 1 of the foundation module. These are the learning objectives. Describe the terms of the relationship which are commonly used in anatomy. Describe the anatomical terms which are used specifically for the limbs, and describe the terms related to the movements. First of all, you should know what is anatomical position. You can see in the picture, the person is standing erect, the arms which are straight by the sides, the legs they are close together, and the eyes are facing forward, and the palms are also facing forward. The little finger should be on the medial side and the thumb will be on the lateral side as the palm is facing forward. So this is the normal anatomical position of a body. Now, what are anatomical planes? Usually, we use 4 anatomical planes in anatomy. Number 1 is the median plane, which is also called as sagittal plane. You can see here in the diagram, this is median plane. Median plane, it is a vertical plane in the midline which is dividing the whole body into 2 symmetrical halves. This is the right half and this is the left half of the body. Both halves are symmetrical. So this will be a median plane, which is a vertical plane from the center of a body which will divide the body into 2 equal right and left halves of the body. Then number 2, any plane which is just beside the median plane, which is called as the paramedian plane. That will also be a vertical plane which will be parallel to the median plane. Then number 3, coronal plane. Can you see this plane which is in this direction? This is also a vertical plane, but this plane will be at right angle to the median plane. You can see here it is making 90 degrees angle with the median plane. So this is a vertical plane at right angle to the median plane, dividing the body into anterior half and the posterior half. So the body will be divided into anterior and posterior halves by the coronal plane, which is also called as frontal plane. Then the horizontal plane, which is also called as the horizontal or transverse plane. This plane will divide the body into upper half and the lower half of the body. Now, the terms of position. First of all, you should know in the body that which is anterior, which is posterior. There are many terms of position. So, we will talk about it. Number 1, anterior. Can you see in this diagram? This is the anterior part, or this is the anterior position, okay, or anterior view. You can see all these features or these organs or these sites in body anteriorly. Okay, so this is the position on the front of the body. Then posterior. Posterior will be on the back. See here, this is posterior. This was anterior and this is posterior. Anterior is also called as ventral and posterior is called as dorsal. Then what is medial and lateral? Can you see here this line? This is the median plane or midline, and any structure or any position which is near to the median plane will be called as medial, and any position which is away from the median plane is the lateral, and in between the medial and lateral this is the intermediate point. So medial, lateral and intermediate. Then superior and inferior. Can you see here the positions which are nearer to the head are called as superior in position, and the position which is nearer to the lower end of the body is called as inferior. So this is superior and this is inferior. Then what is proximal and distal? Proximal means the position which is nearer to the root of the limb. Root of limb means from where the limb is originating. So this is proximal, which is nearer to the root of the limb is proximal, and the position which is away from the root of the limb is called as distal. So in this diagram you can see here this is the proximal position, or this is the hand is in the distal position. So this is proximal and distal, which is distal is away from the root of the limb. Then we will talk about the superficial and deep. So the structures or the position which are just superficial or nearer to the surface of the body are called as superficial, and the position which is away from the surface of the body is called as deep. Then we will talk about internal and external. So the position which is nearer to the cavity of the organ, for example, which is inside the body, we have the pleural cavity or the pericardial cavity or the peritoneal cavity. So the position which is nearer to those cavities are called as internal, and external, which is the position which is away from the cavity of the organ or nearer to the surface, they are called as external. Then ipsilateral and contralateral. What is ipsilateral? It is the same side of the body. For example, the right side will contain the right upper limb and the right lower limb. These two are ipsilateral. Here in this diagram it is shown here. This is ipsilateral, left side. And contralateral means if we are talking about one side upper limb and the other side lower limb, that will be contralateral to one another. Okay, then we will talk about the spine and the prone position. Supine means, can you see here in this diagram, supine means the ventral surface of the body, or which is called as the anterior surface of the body. It is directed upward. Just we are lying on a bed. Okay, so this is supine position. But the prone position, when the ventral surface of a body is directed downward, or you can say the posterior surface of a body is directed upward, that is the prone position. This is prone and this is supine position. Now, this is the revision, or you can say these are the terms which are used in relation to the trunk. Okay, we will talk about the limbs and trunk separately. Now, first of all, the trunk. In the trunk, the ventral or anterior is the front of the trunk. This is ventral or anterior. Then the dorsal will be the back side, or which is dorsal or posterior. Medial means which are closer to the midline. So these are the medial structures. See here, this will be all medial structures. And lateral, which are away from the median plane. See here in this diagram, this is the midline. These are the medial position. This is the medial position, and lateral is away from the midline. So medial is closer to the midline and lateral is away from the midline. Here also you can see proximal is the point which is nearer to the root of the limb, and distal is away from the root of the limb in upper as well as in the lower. But when we are talking about trunk, so you can see here we will always talk about the root of the limb. Okay, so that will be proximal and distal. See here, this is the superior end, then this will be the inferior end. This is the median line. The structures which are closer to the median are the medial, and the lateral which are away from the median plane. Then ipsilateral means of one side, contralateral means of the opposite side. Ventral or anterior is the front of the body, and dorsal or posterior will be back of the body. Now see here, the proximal or the cranial or superior. See here how we will talk about in the trunk. The proximal will be close to the head end of the trunk. So this is the proximal of the trunk which is closer to the head. Here also that proximal part will be more towards the head end of the trunk. Okay, that will be called as proximal or cranial or superior, because cranial is also related with head, and superior, we know that the superior is also related with the head. But the distal part or the caudal part or the inferior part is that part which is closer to the lower end of the trunk. So this is the lower end, so this is distal. Here also when we compare, this is closer to the lower end, so this is distal. Okay, and then the lower limb, or this is towards the tail end or the caudal end of the trunk. Superficial means the close to the skin. Okay, so those structures which are closer to the skin are superficial, and those structures which are away from the skin or the surface of the body, they are deep. Okay, so you should know the superficial and deep. Now in this diagram, this is a very good diagram in which you can know that this is unilateral of one side. This is bilateral of both sides. Bi means both, two sides. Then this is ipsi. Ipsi means same side, upper limb and lower limb of the same side. Then contralateral of the opposite side. For example, they are talking about the right lower limb and the left upper limb. So this is contralateral. Then we will talk about the invagination and evagination. Invagination means it is projecting inside, and when this pink area, it will be projected outside, that will be evagination. Okay, that is the projection outside. You can see here in this diagram, this is the invagination. The arrow is going inside, and this one, this is the projection, it is coming outside. So this is evagination. See here, this is the body cavity, and the structures or the surface which is away from the body cavity is called as superficial, and the structure structures which are closer to the cavity of a body is called as deep structures. Or you can say, with respect to the skin, you can say those structures which are closer to the skin, that is superficial, and those structures which are away from the skin will be deep structures or deep position. Now we will talk about the terms which are used in relation to the upper limb. Actually, this will be a revision or some new terms will be used here. Ventral or anterior, you know this thing. We will talk about the upper limb only. Ventral or anterior means the front side, and the dorsal or the posterior means the back side. Medial border, you can see here, this is the medial border in this diagram they have shown here. This is the medial border where there is the little finger. See here, this is little finger. This is the medial border of the forearm, and this will be the medial border of the arm, and it will go up till the axilla. So this is the medial border. So when we talk about the lateral border, in the same diagram they have shown in this upper limb the lateral border here. Can you see this is the lateral one? Because over the thumb side, can you see the thumb side here? Thumb, this is the lateral border of the forearm, and this is the lateral border of the arm. Okay, so this is the lateral border, thumb side, and the medial border which is on the little finger side. Proximal, so this is proximal part which is closer to the root of the limb, and the distal end which is closer to the or away from the root of the limb. Okay, then the palmar aspect, can you see in this diagram? This is the palmar surface of the hand, and this will be the dorsal surface or dorsal aspect of the hand, which is the back of the palm. On the front it is the palm, so called as palmar surface. On the back it is the dorsal surface, which is the back of the palm. Then the flexor aspect, you can see here anteriorly all flexor muscles are present in the upper limb. So the front of the upper limb is the flexor position or the flexor aspect, whereas the posterior side, this one is the extensor. All the extensor muscles, they are present on the posterior surface, so that surface is called as the extensor aspect. Okay, so flexor and extensor, it is opposite to that in the lower limb. Now we will talk about the lower limb. See here, anteriorly, this is the anterior aspect, you know, the front of the lower limb. Then this is the dorsal aspect or the posterior aspect, which is the back of the lower limb. Then this is the medial side. Can you see here the medial border which lies along the big toe? You can see here, this is the big toe or the hallux. Hallux is a word which is used for big toe in anatomy. So this is the big toe, then the medial border of the thigh, leg, and then the medial border of the thigh. See here, this is the medial border. Then we talk about the lateral border. Can you see here the lateral border on both sides? This one is also the lateral border. Lateral border is along the little toe. See here, this is little toe. Then there will be the lateral border of the leg, and this is the lateral border of the thigh. So this is the lateral border of the lower limb. Then the flexor aspect, as I have already told you, then the flexor and extensor aspects, they are opposite to that in the upper limb. So the flexor aspect is the back. See here, this is the back of the lower limb. All these are the flexor muscles, and the extensor muscles, they are on the front of the lower limb. Proximal will be closer to the root of the lower limb, that will be proximal part, and the distal will be away from the root of the lower limb, that will be the distal part. Now we have talked about the terms of position. Now we will see some of the movements. What are the terms of movements? Okay, so what is flexion? You should know the flexion. Flexion is a movement in which we are approximating or bringing closer the anterior surfaces to one another. See here in this diagram, this was the anterior surface of the arm, and this was the anterior surface of the forearm. So when we bring two anterior surfaces closer to one another, that is called as flexion. Or when we are moving the anterior surfaces of two surfaces away from each other, so this is called as extension. These both are opposite to one another. Again, I will repeat, the flexion is the approximation of the anterior surfaces to one another, and the extension is movement of the anterior surfaces away from each other. This is extension. Now we will talk about the adduction, that is adding up, and abduction, which is moving away. So adduction means the movement of the limb towards the median plane. See here, this is the median plane, and we are moving the limbs toward the median plane. We are adding them together. This is to add them, adduction. And abduction means the movement of the limb away from the median plane. So we are moving the limb away. This is called as abduction. Now we will talk about the medial rotation and the lateral rotation. In the medial rotation, movement of the ventral surface or the anterior surface toward the midline. You can see here the anterior surface, they have moved towards the midline. And here in the lateral rotation, the movement of the anterior surface, this is the anterior surface away from the midline. So this is called as the lateral rotation. Circumduction is a group of movements which includes the flexion, the abduction, the extension and adduction. It means the flexion and extension and abduction and adduction, they are grouped together in circumduction. You can see here when we are moving the limb in all directions. So this is circumduction. Now we will talk about the pronation and supination. You can see in this diagram, pronation means when the palm is directed downward. So that will be the pronation. This one when the palm is directed downwards, or you can say the palm, the posterior surface or the dorsal surface is facing anteriorly. This is pronation. And supination means the palm is directed upward or forward or anteriorly. That is supination. This is supination. Okay. Then opposition. Opposition means, I will show in another diagram, when we approximate this thumb, for example, this one towards some finger, maybe toward the index finger or the middle finger or the ring finger, that will be called as opposition of the thumb. It is related with the thumb, that is approximation of thumb to other fingers. Okay, this is the pronation and supination and opposition. Then we will talk about the inversion and eversion. You can see in this diagram, inversion means the sole is directed inward. You can see here the soles, just like palm. This is the palm. We have the lower surface or the down surface of the foot, which is called as the sole. So if the sole is facing inward, that is called as inversion. And if the sole is facing outward, that is called as eversion. So inversion when we move our foot towards the inner side, and eversion when we move our foot toward the outer side. Okay, so this is inversion and eversion. Then elevation and depression. You can see here the movement of the shoulder. This is moving up of the shoulder is called as elevation, and moving down of the shoulder is called as depression. Then we will talk about the protraction and retraction. This is about the movement of the jaw or the temporomandibular joint. So this is the protraction when we are moving the chin forward, and retraction when we are moving the chin posteriorly or backward. This is in the anterior direction and this is in the posterior direction. So this is the protraction and retraction. Now, this is some of the revision movements. You should know what is gliding movement. Can you see here in this diagram? We are gliding the hand. Okay, the relatively the flat surfaces move back and forth or from side to side concerning one another. The angle between the articulating bones, they does not change significantly. For example, the intercarpal joints. You can see here these are the carpal bones and there will be intercarpal joints. So they will glide over one another. The angle will not be changed in this type of the gliding movement. This is one movement in which there is no change of the angle. But second one, when there is the change of angle, that is called as the angular movement. There are many types of the angular movement. Number one, when the angle between the articulating bone may be decreasing or increasing, that is angular movement. So number one, flexion. What is flexion? When there is a decrease in the angle between the articulating bone. For example, you can see in this diagram, if we make our arm straight, okay, that was the extension. See here, this was extension. This is the angle of 180 degrees. Okay, but when we decrease the angle, you can see here in the diagram that this is one bone and these are the other bones. So when we decrease the angle between the articulating bones, this is called as the flexion. Okay, this is the decrease in the angle and this is the increase in the angle between the articulating bones. This is called as extension. Lateral flexion. What is lateral flexion? it is the movement of the trunk sideways to the right side or the left side of the waist. You can see here this is moving towards the right side, and if the body is moved or trunk is moved on this side, that will be left lateral flexion. So this is called as lateral flexion. Adduction. What is adduction and abduction? Adduction means movement of the bone toward the midline. There will be toward the midline. You can see here this was abduction, and now the boy, he is doing the adduction. He is moving the limb toward the midline. That will be arm adduction. And if he moves away from the midline, that will be the abduction. See here in this diagram with the lower limb, you can see here when we are moving the lower limb towards the midline, that is the adduction, and when we are moving away from the midline, that will be abduction. Flexion means when we decrease the angle between the two articulating bones in the lower limb also, that will be flexion. But when we increase the angle in between two articulating bones, that is called as extension. You can see here in upper limb also, see here when there is the angle which is decreased between the hand and the forearm, that is called as flexion. Then this was extension when we have increased the angle, and when we over increase the angle, that will be called as hyper extension. Hyper extension. You can see here now the angle is increased from 180 to maybe 250 or like this. So this is hyper extension. Now in the foot we have two movements. This is called as dorsiflexion because the above surface is the dorsal surface and the below surface is the plantar surface. See here, this is the plantar surface. So how many types of flexion are there in the foot? This is dorsiflexion, means when we are moving the dorsal surface of the foot toward the leg, that is the dorsiflexion. Okay, and the plantar flexion means when we are moving the plantar surface or the sole of the foot toward the back side, that is called as the plantar flexion. Plantar flexion, because we are decreasing this angle which was in between the posterior surface of the leg and the sole of the foot. So we are decreasing the angle. Here also we are decreasing the angle between the dorsal surface of the foot, or the you can say the above surface of the foot with the anterior surface of the leg. So we are decreasing the angle in both cases, but here the dorsal surface is decreasing the surface. Here the plantar surface, it is moving backward to decrease the angle. So it is called as the plantar flexion and dorsiflexion. Now what is rotation? Rotation means a bone revolves around the longitudinal axis. Longitudinal axis, I have already told you, here we will talk about the anterior surface of the bone in both the medial rotation and the lateral rotation, and we have to move the anterior surface of the bone either towards the midline in the medial rotation and away from the midline in the lateral rotation. You can see here in this diagram, this was the anterior surface, and in this one they have moved the anterior surface toward the midline. This is called as the medial rotation, and here they have moved the anterior surface of the limb away from the midline. That is called as the lateral rotation. Now there are some special movements also which I have already discussed, which is the pronation and the supination. We have at the radioulnar joints, we have protraction and retraction to move the chin forward and backward at the temporomandibular joints. These are the same which we have discussed already. See here, again the protraction of the mandible, the retraction of the mandible, this is elevation, and the depression, this is the opposition of the thumb. When we approximate the thumb to the other fingers, maybe toward the index finger or to the middle finger or to the ring finger or the little finger, that is called as the opposition of the thumb. This is the pronation and the supination. When the palm is facing anteriorly, that is called as the supination, and when the palm is facing posteriorly, that is called as the pronation. This is dorsiflexion, when we move our foot toward the leg on the anterior side or the dorsal surface of the foot is decreasing the angle, that is dorsiflexion. But when we make our foot towards the plantar surface or flex it toward the plantar surface, that is called as the plantar flexion. Inversion means when we are facing the sole of the foot toward the inside or the toward the midline, that is called as inversion, and when we face the sole of the foot away from the midline, that that is called as the eversion. This is the eversion. So these are the same movements. Upper limb, you know, flexion now when we brought anterior surfaces or the flexor surfaces toward one another. Extension when we are extending or increasing the angle between the anterior surfaces, or you can see here when we straighten the arm. Can you see the straighten the arm and the forearm? That will be the extension here. This is the extension. So we have increased the angle also, we have straightened here. But in the flexion, we have decreased the angle and we have flexed it or bend it. So this is flexion. In abduction, what we will do, we will move the limb away from the midline. So that will be abduction. In adduction, when we move it toward the midline. Circumduction, when we move it in the circular manner. This is the circumduction. Okay, you know medial rotation now. You will have to talk about the anterior surface or the flexor surface towards the chest or towards the abdomen. That will be medial rotation. Lateral rotation when the anterior surface away from the body. So you have to talk about anterior or the flexed surface or flexor aspect of the arm and the forearm. Supination, you know this thing, palm is facing forward or upward. Pronation, when the palm is facing backward or downward. You know the abduction and adduction of fingers also. In adduction, we will move the fingers toward one another. In abduction, we will move the fingers away from one another as the or to separate the fingers. The axis will be the middle finger. So you will move a thumb and the index finger on one side of the middle finger and the ring finger and the little away from the middle finger. So middle finger is the axis actually. Then the opposition, you know the opposition, circumduction. It is the movement or combined movement of extension, abduction, flexion and adduction in sequence. Now this is again the repetition, the lower limb, flexion of. We will talk about the lower limb movements. Flexion of the thigh. Can you see here? These are the flexors of the thigh at the hip joint. So when the front of the thigh comes in contact with the front of abdomen, this is called as the flexion of the thigh. Flexion of the thigh. Then the extension of thigh when a person stands erect. You can see here when the person is standing erect, this is called as the extension of thigh. Then the abduction when the thigh is taken away from the median plane. You can see here this is the abduction when the thigh is moved away from the median plane. And here this is the adduction when the thigh is moved towards the median plane. This is adduction. Medial rotation when we turn the limb or the thigh medially, this is called as medial rotation. And when the thigh is turned laterally, this is called as the lateral rotation. Now this was about the thigh. Remember this thing, flexion of the thigh and extension of the thigh. Thigh is the upper part of the lower limb. Now we will talk about the knee, flexion of knee. Now here it will be opposite. See here, this was the hip flexion when we were moving toward the abdomen, and this was the hip extension or the thigh extension when we were making the thigh erect. But now we will talk about the flexion and extension of the leg, which is at the knee joint. Remember this thing. These are very important points which you have to remember to know the muscles action or all the movements of the muscle. See here how the knee extension will be done when the thigh and leg, they are in straight line as in the standing. So this is the extension, knee extension, which is just similar to the hip extension when we were standing erect. But the hip flexion and knee flexion, they are opposite with one another. In the hip flexion, we were moving the thigh forward, but in the knee flexion, we have to move the thigh and the back of the leg backward. Okay, when the back of the thigh and the back of the leg, they will come in approximation. They will come close to one another. That is called as knee flexion. Okay, so remember this thing. We have already discussed the dorsiflexion when the dorsum of the foot brought closer to the front of leg. That is called as dorsiflexion. Plantar flexion when we are moving the sole or the plantar aspect of the foot facing backward. That is called as the plantar flexion. We know the inversion and eversion. Inversion, as we have already discussed, when the medial border of the foot is raised from the ground so that the plantar surface it is facing inward. And in the eversion, when the lateral border of the foot is raised from the ground. So you can define it in two ways, by the medial and the lateral border. border when they are away from the ground or raised from the ground. For example, in the inversion, we have to raise the medial border of the foot away from the ground. But in the eversion, you have to raise the lateral border of the foot away from the ground. So what will happen in the inversion? The plantar surface will be facing inward, and in the eversion, the plantar surface will be facing outward. Now in the neck, you can see here what is flexion. Flexion means when you are moving the face towards the chest or closer to the chest. This is called as the flexion of the neck. Extension, when you are moving the face brought or bringing away from the chest. See here, you have to bring away the face from the chest. This is the extension. Then the lateral flexion, you can see here when the ear is brought closer to the shoulder. This is the right sided lateral flexion. And this one, when you will bring the left ear toward the left shoulder, that is the left lateral flexion. And what is rotation? When you are rotating the neck so that the chin goes to the opposite side, that is called as the right rotation if going toward the right side, and the left rotation if it is going toward the left side. Now opening the mouth, you can see here when the lower jaw is lowered to open the mouth. Closing the mouth, when the lower jaw is opposed to the upper jaw, closing the mouth. Protraction and retraction, we have already discussed it. In the trunk, when we are bending the trunk backward, this is called, when we are talking about trunk, already we have talked about the neck. Now we are talking about the trunk extension and flexion. The extension is the backward bending in the trunk. This is called as extension. But we are bending the trunk forward. This is called as the flexion. Then the sideward movement of the trunk is called as the lateral flexion. Then the sideward rotation, when we are moving the whole trunk to the other side, this is called as the lateral rotation. So these are the four movements in the trunk. You should know in the muscles what is the origin and the insertion of the muscle. See here, origin, from where the muscle is originating. This end of the muscle, it is relatively fixed during its contraction. It will not move. See here, this muscle, it is originating from the bones here. So this is the origin, and this origin is fixed. But the insertion, where it is inserting, where it is ending, so that end of the muscle which is moving during contraction is called as insertion. So remember this thing, origin doesn't move, but the insertion moves during the contraction. What is belly? Belly is the main or the middle part of the, or the fleshy part or the contractile part of the muscle is called as belly. What are tendons? Tendons are the fibrous non-contractile part or the cord-like part of a muscle. This is called as tendon. Then aponeurosis, you can see here, this is the aponeurosis. This is also aponeurosis. This is the flattened tendon. Okay, see here, this is the flattened tendon. Then what is raphe? Can you see here in the middle? This is a fibrous band which is made up of interdigitating fibers of a tendon or the aponeurosis. So the muscle fibers, they are interdigitating here at the raphe. Okay, this is the raphe, but this is separate or this is something different from the ligament because it is stretchable. Okay, unlike ligament, it is stretchable. The ligaments are fibrous, inelastic bands which are not stretchable, and the ligaments, they connect the two segments of a joint. But the raphe, it is in between the bellies or the in between the interdigitating fibers of the muscle. Okay, this one is elastic, the ligament is fibrous, inelastic band, and it is between, the ligament is between the two segments of a joint, not between the muscles. So this was the lecture about the terms of movement and position. I hope you understand it. Thank you very much.